Welcome, everyone, and welcome to our 4:30 press conference on Friday, January 8th. Today, we will be bringing you a COVID-19 update with our county public health experts as well as some special guests. They are coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vondo Reynoso, with Dr. Daniel Shepard, Director of Santa Barbara County Emergency Medical Services, and Ron Werft, who is President and CEO of Cottage Health System. Following their updates, we will open it up to questions from our News Corps, who are in our Zoom today. As a reminder for the public watching, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language from Kim Rich with the Independent Living Resource Center. Videos of the press conference will be available shortly after the conclusion of this press conference, both in English and Spanish, on the county's YouTube channel at CSB-TV 20. We are also being shown live on CSB-TV channel 20 for Cox Cable customers. And with that, I will now turn it over to County Public Health Director, Dr. Vondo Reynoso.
Thank you, Gina. Good afternoon. Before the holidays, I spoke at a press conference and announced that our data was the highest it had ever been. I urged the importance of not gathering during the holiday season. At that time, our numbers were soaring, and I was worried. I was fearful that if people gathered, we would have a surge on top of a surge. The data I am going to present today is almost twice as high as the December 22nd date when I shared my concern at a press conference, and a 10-fold increase between Thanksgiving and the New Year. Unfortunately, we are indeed seeing a significant uptick in COVID activity due to gatherings and travel around the holidays. The Santa Barbara County Public Health Department analyzes COVID data in multiple ways. We look at the epidemiology of the data by day, by week, and by quarter. Today, I would like to discuss concerning trends being seen day by day and by week. The quarterly data is being analyzed, and I look forward to sharing that with you in a few weeks. When we look at COVID data by day, what we see is off the chart increases. And when I say off the chart, I literally mean off the charts. This week, our numbers increased by so much that we had to adjust the axes and the scales of the charts and maps. I cannot report today's data due to a delay in CalReady system. However, I can report data from yesterday. So yesterday, we saw 512 new COVID cases. This is the highest number of cases ever reported in one day. We reported 1,938 active cases, nearly a record high. 178 hospitalized due to COVID, of which 59 were in the ICU, both of which are peaks. 4 new reported deaths. Our case rate was over 60 per 100,000, a new record. And testing positivity was 16.5, also a new high. When we look at data by the week, our numbers are also concerning. We recently analyzed data from the week of December 27th through January 2nd. During this time, we had an alarming increase in the number of cases, active cases, and testing positivity. The number of cases by week increased from 1,324 in the week prior up to 2,022. So this is about a 53% increase in the weekly case counts. Active cases by week increased by 19% to 3,686. Testing positivity soared to 17%. So that's approximately one positive for every 16 test results. When we look at when people are getting sick, there is a clear increase after the winter holidays. In addition, during the week of December 27th through January 2nd, we had 6 business outbreaks, 2 in administration, 1 in skilled labor, 1 in a grocery store, and 1 in retail, and 8 congregate setting outbreaks. Onto vaccines. Vaccine distribution continues to be a top priority for the Public Health Department. To date, we have received 16,775 doses. Today, or actually a few days ago, we ordered 900 doses, and we anticipate that next week we'll be ordering 7,200 more doses. The opening of our vaccination pods throughout the county have amplified our effort to vaccinate our phase 1 healthcare workers, and including those in the EMS system. Through the 3 pods this week, we vaccinated over 600 individuals in this phase. The amount of vaccination administered will be expanding even further in the coming weeks. We plan to increase to 2,100 vaccinations next week in our pods, and our goal is to finish the month with vaccination of 5,000. Testing for COVID-19 remains a critical element as the surge of cases continues to rise in Santa Barbara County. As part of the expanded testing being made available, we will now have mobile testing available beginning next Monday, January 11th, which will be available to all community members. The first location of the mobile testing will be in the Santa Barbara at the SenCal parking lot located at 4050 Calle Real. On the first day, the hours will be from 9:30 a.m. to 7 p.m. After the first day, the mobile testing site will be available Monday through Friday from 7 a.m. to 7 p.m. And after a minimum of 2 weeks, the mobile site will move to a new location. So we are exploring moving to Carpinteria and moving to Lompoc soon after. The community can request an appointment by going online to lhi.care/COVID testing or call 211 if you need assistance making an appointment. Thank you for your diligence in keeping our community safe. And now I'd like to introduce you to Dr. Shepard, who will be giving his insights as the EMS Medical Director.
Hi, everyone. As Dr. Doran also said, I'm Daniel Shepard. I'm an emergency physician. I work at Santa Barbara Cottage Hospital and Goleta Valley Cottage Hospital, but I'm also the medical director of the Santa Barbara County Emergency Medical Services Agency. The way I like to put it is that I'm the doctor responsible for the care you receive when you call 911. And I'm one of the doctors you may see when you come to the emergency department. I've been practicing medicine for about 10 years, and I've been here in Santa Barbara for 6. The COVID-19 pandemic has presented challenges that few in modern healthcare have faced. It's inspiring to see the healthcare community rally and do everything they can to meet this challenge. We're doing our best to ensure that the residents of Santa Barbara County get the care that they need. Healthcare teams make sure that treatments go to those who need it, while the administrators, support staff, they've been working tirelessly to procure the supplies that we need. It truly is a team effort. We have doctors, nurses, ED techs, patient care technicians, radiology technicians, respiratory therapists, environmental services. Your healthcare community is certainly strained, but committed, and we're all working together to give the best care possible. The Public Health Department, Emergency Medical Services, or EMS, a county CEO's office, hospital CEOs, we're all collaborating on every aspect of the response to the pandemic. We're discussing how resources can be rationed, staffing models, providing care in non-traditional locations. We're doing our best to maintain our current care models. And I think that those locations are where care really is best served. And so we're trying to make sure that we do everything we can to preserve that. Surges in other communities have demonstrated that we may need to make some difficult decisions. There's definitely some challenges in other areas that have really given us insight into what this pandemic is capable of producing. Hospitals are establishing scarce resource allocation teams that help our clinical teams decide, who would get what. For example, if 2 patients need a ventilator, only one is available, the scarce resource allocation team will evaluate the case and allocate the ventilator based on the probability of survival and ethical principles, not age, race, wealth, gender, those sorts of issues. The teams are independent of the care team. They don't even know the identity of the patients. So we're really focusing on providing the necessary care in the best manner possible. We hope to have enough ventilators, but if there's only one, we have a plan that is ethical and evidence-based. Traditionally, our neighbors help us when we're in crisis and vice versa. The impact of COVID is really widespread, as we've seen, and we must find innovative ways to care for those who are in need. That is why the collaboration and the partnerships that we enjoy here in our community are so important, and it's really it's essential that we work together. Emergency medical services, or 911, is a newer facet of healthcare when compared to traditional delivery models. But during a pandemic, we have a lot to offer. Santa Barbara's EMTs and paramedics are responding to emergencies, testing for COVID, caring for patients in skilled nursing facilities, and giving vaccines. This pandemic is a dynamic situation. We are adapting to the needs of the community and adhering to the principles of distributive justice. I am laser focused as a medical director on maximizing benefit and serving the greater good. If there's a gap EMS can fill, we will be there. Everyone in healthcare is being asked to do things that are different than what we typically do in our jobs. I'm going to implore all of you to do something that may be outside of your comfort zone. I encourage everyone to fill out a physician's order for life-sustaining treatment. At the very least, tell your loved ones how you'd want to be cared for if you can't make decisions for yourself. I believe in the principle of delivering the right treatment to the right patient at the right time. And healthcare is not one size fits all. We're going to make the extra effort for you. Please make the extra effort for your frontline providers. Reserve 911 and the emergency department for emergencies. If you have access to a primary care provider, utilize them. If you don't have a primary care provider and it's not an emergency, consider urgent care. I know the health officer orders are challenging, but the big victims of this virus are our neighbors, friends, and family. It's heart-wrenching to see people with this disease suffer, and the daily struggle against the virus takes a toll on healthcare providers. We need to get this under control, and you all can help. Physically distance, wear a mask, and look out for each other. So now I'd like to introduce Ron Werf, the President and CEO of Cottage Health.
Thank you, Dr. Shepard, and thanks for the invitation to be part of your press conference today. I want to just cover really 4 things quickly. First, to give a report on hospital status and trends and our plans for responding to this continued increase in COVID patients. How we're managing transfer requests for more heavily impacted areas throughout California. Our vaccine program and our plans for expansion, and then just really a message from our staff to the community. And so my report on the hospital statistics are very similar to what you heard from Bondo Reynoso at the beginning of this. But before I give some numbers on that, I want to thank the physicians and the nurses, the therapists, the environmental service workers, the dietary workers, who are now in their 11th month of providing care for COVID patients, and now in our 3rd significant wave. And it's extremely hard work. We've been through many disasters in our community. This is like nothing that we've ever seen before. And so we can never thank them enough for the work that they're doing and their dedication. It's a very long road. Secondly, I want to just comment, as others have, on the collaboration. I think it's as good or perhaps better than it's ever been. I speak for all of the hospitals in my report, but I can tell you that we are in daily discussions or more to collaborate on the management of what's happening in our community. Extremely good working relationships among the 3 hospitals to make sure that we are working together to save lives in this community. We also are collaborating on a daily basis with County Public Health Department, and there's nobody in this community who can do this by themselves. And so I just want to express my gratitude for the partnerships that we have. Just some numbers for you. This is the third wave, but it's quite different from the first two waves. Bondo Reynoso referred to the peak. For Cottage Health, the peak that we're seeing of COVID patients is 3 times the highest peak that we saw in the first two waves that came at our community. And just to demonstrate how quickly things can change, my numbers are just a little bit different time frame from Bondo Reynoso's, and that is we were looking at Thanksgiving, where Santa Barbara Cottage Hospital was caring for 9 patients with COVID in a single unit. And today we're taking care of 90 patients at Santa Barbara Cottage Hospital with COVID. 23 of those are in the intensive care unit. We look at our laboratories trending data, and on Thanksgiving, the positive rate, we look at the 7-day trailing average was 4.8%. And today, the 7-day trailing average positive rate from all the tests that we're doing through our laboratory is 17.5. So that's a lead indicator, and it's one of the indicators that tells us that this is far from over. We're continuing to see a rising tide, and we're working very hard on surge planning, as we have all along. Already, we've gone from that 1 isolation COVID unit at Thanksgiving to now 5 isolation COVID units at Santa Barbara Cottage Hospital. In addition to 2 of those are ICU units, a 17-bed unit and a 20-bed unit. And in addition to that, we have a non-COVID ICU for medical conditions, medical surgical conditions for patients that do not need to be isolated and don't have COVID. And we have triggers for continuing to expand that capacity to do our level best to stay ahead of the curve here. I would differentiate from the early parts of the pandemic in the following ways. Early on, the issues were PPE to protect our staff, and very big concerns about ventilators. And so the good news is that we're in very good shape on both of those fronts. We've got long line of sight on supply chain and, in fact, inventory for protective equipment for our staff. And just the numbers, today we've got 98 ventilators and only 21 of those are in use. So those are not the concerns. As we look to a rising demand on our hospitals, and for Santa Barbara, and I know I'm speaking for Lompoc and for Marion as well, beds are not going to be our challenge. PPE ventilators are not going to be the challenge. We have 45 staffed ICU beds. Let's just focus on ICU for a moment. We can flex up, if we had staff, to 57 licensed ICU beds at Cottage. And we have plans that would take us to 70 ICU beds at Cottage, with another 8 beds at Goleta Valley that are licensed for ICU. That's not the problem. The problem is critical care staffing. And so while we're staffed right now beyond what we would normally see as critical care volume at Cottage, the ability to identify, recruit, and expand up to that kind of demand is very challenging for every hospital in the country, including your hospitals here on the Central Coast. So that's our issue. The surge plans are underway. There are things that are being done to address that. We had, I believe, 21 new RNs in our orientation on Monday, who will be starting very shortly. But the need for more staffing continues. So we are offering incentives to our part-time staff to take on additional shifts to help those who are already working full-time now for a long, long time, and other measures to make sure that that we can stay ahead of that to the best of our ability. I would just say that as solid as all of our hospitals are on the Central Coast, there is a limit to what we will be able to do. And you've seen that in other communities in Los Angeles and elsewhere in the country. So just want to make that point. Let me touch on transfers quickly. That's been an issue of where we've had a lot of questions about that. And as both Central and Southern California hospitals have really hit the wall, where they have gone to 0 ICU beds. And in fact, there are hospitals, major hospitals in LA operating at 124% of ICU bed capacity. We have been getting more and more requests for transfers. And so nearly a month ago, we set up, we receive generally 2 to 4 transfer requests every 24 hours. Most of them are at night. And so these are from hospitals, sometimes in our region, sometimes beyond our region, as far away as Ridgecrest, northern part of the San Joaquin Valley, down into Los Angeles as well. And so we've set up a triage and screening process to review every single transfer request. There are federal laws that govern how hospitals respond to and manage requests for transfers from emergency departments in other hospitals. And so what we do on every one of these calls is we look first and foremost at our own capacity. Do we have sufficient medical surgical ICU staffing capacity to help if needed? Are we in fact a higher level of care? And has that hospital exhausted every possible solution between that hospital and Santa Barbara before we would consider taking a patient? We must have resources, be at a higher level of care, and not compromise our ability to provide care for our local community. So I can tell you I'm on those calls half the time. I share that with our executive vice president at Cottage, along with a senior, our chief medical officer, and our nursing administrator, and our nurse staffing office. So every single night we're reviewing those, and we've become, there have been very few patients who we have been able to say yes to. Every one of these has been a situation where it has been a life-threatening situation. There were no solutions. We had capacity and a higher level of care to manage that. And so that has been the only situation where we have said yes to that. Thirdly, vaccines. Quickly, we started our vaccine program the day the vaccine arrived now, roughly 3 weeks ago. And we have now administered just under 3,400 vaccines to our physicians, to hospital workers, and to others who interact with patients in our hospital on a regular basis. We have been working over the last week on expanding that so we can add to what the county has rolled out, what Sansom Clinic and other providers are doing as well. We are setting up a drive-through vaccine site at Patterson and Hollister in the parking lot across the street from Goleta Valley Cottage Hospital. I can't give a definite date. Our goal is to have that open by the end of next week or very shortly the following week. And we will provide vaccines there for the rest of the medical community that has not yet qualified. These would be frontline patient-facing office staff, of members of our medical staff, and others who are interacting on a daily basis with patients. And then we plan on keeping that going. And the more vaccine we get, the more we can do. And we will work very closely, as we have with you, Vaughn, and your team on what the next tier should be for our contribution to that program. We're all in this together. The last point I want to make is really, I'm going to be a spokesperson for our staff, and just make the point that they're doing an amazing job. Thank you, Dr. Shepard, for your comments. You see it every day in the ED. It's been now in their 11th month, and you can be very proud of the work that they're doing. Nationally, the mortality rate, the mean average is 12%. The best 20% in the country, the best quintile is 9%, and the mortality rate at our hospital is 8%. So we've got an unbelievable medical staff, nursing staff. We're doing a great job. But I want to say again, there's a limit to what we can handle if the numbers continue to rise at this rate. And so while our staff are so grateful for the outpouring of community support, the posters, the banners, all of the wonderful things the community did for us early on and throughout the summer, the ask now is to protect yourself, protect those around you, because not only are you protecting yourself, but you're helping our staff who are so burdened with this for so long now. It's the most important thing you can do is pay attention to the messages from public health on the right practices within your household. You know all of the others, I won't repeat them. But that, as you think about our healthcare heroes, what they're going through for our community, you can help them help you. And that, in fact, will save lives. Thank you.
Thank you so much, Ron, as well as Dr. Shepard and Ron. So first up, we're going to go to Tom Bolton with NewsHawk. Oops.
Thank you very much. I have several questions, so I'm going to try to move quickly here in deference to the others. My first one is for Dr. Dorenoso regarding testing, the expansion of testing. Has there been any change in the criteria in terms of who should be getting tested at this point?
Hi, Tom. Thanks for your question. No, there is no change in criteria. I do want to let everyone know that our mobile testing that is going to start on Monday at the SunCal parking lot can test 500 appointments a day. And so that's a huge, huge expansion for our South County access to testing. And we will be taking this mobile testing opportunity throughout the county so that all the different communities can have access to that expansion.
So quickly, who should be getting tested right now?
I think that anyone who has been out and about, who has come into contact, who has symptoms, who has traveled, who has engaged in gatherings with those outside of the household, essentially anyone who has been involved in activities that takes them away from their own household.
Okay, thank you. We've heard that the pace of vaccination, certainly nationally, has been well behind what had been hoped and expected. I'm wondering what factors, if any, are limiting the pace of vaccination here. You talk about, ordering more doses, et cetera, but
Sure.
What if anything is slowing us down?
That's a great question. I think that two things. The fact that when counties in California rolled it out, it was under the guidance of doing tier 1 in phase 1A. And then sequentially, after you finish with tier 1, you go to tier 2. And then after you finish with tier 2, then you go to tier 3. So that became a bottleneck for us. And I can see Ron agreeing. So that became a huge bottleneck. And with all of the jurisdictions weighing in with the state on Sunday allowed the jurisdictions to do all the tiers concurrently. So I think that allowed us to speed up the access to vaccines in our community. So that's one. The second one is being able to get enough of community providers on board, registered, approved by the state, trained in the vaccine administration. That's a lengthy process. So we were very grateful that our 3 hospital systems were the initial partners and assisting us in vaccinating all of our frontline healthcare workers.
Okay. Also on vaccinations, there's been a suggestion nationally that we move to a system where more people get the first vaccine, even though there may not be a second vaccine dose set aside for them. And I'm just wondering, Dr. Dorenoso and also Mr. Werft, if either of you have thoughts about that.
I think that we are confident, especially under the new administration, that production of vaccines and in addition, more vaccines will come on the market. So we are adhering to CDPH guidance that all the allocation that are given to us should go as first doses. And CDC has safeguarded the second round of doses for those that have given the first dose. So we're confident in that guidance, and we're proceeding with that guidance.
Okay, thank you. Just a couple more questions. I am wondering if somebody can quantify how many, just on average, how many transfer patients are typically here in Santa Barbara County?
I can't do that, Tom. But I don't know the answer to that right now, Tom, but I'm happy to get that for you. I just anecdotally, because I'm on half of these calls, it's going to be a very low number. It's going to be a very low number. We have generally 18 to 20,000 admissions a year, and I can just thinking back over the last week, there might be, I would say, a handful at most, and probably on one hand can count them. So I'm sorry I don't have a specific answer. I'm very happy to get that for you.
Okay, that would be great if you could. And another question for you, Ron, was are all your COVID patients at Santa Barbara Cottage, or are you using Goleta Valley at all?
They're all at Santa Barbara because of the need to cohort them in an isolation unit. Thank goodness we built a new hospital. We can convert these units to negative pressure and make sure that we're not having any cross-contamination. And so it just makes sense in our geography for the patients at Santa Ynez, Valley Cottage Hospital, and Goleta to be transferred to Santa Barbara and placed in an isolation unit.
Okay, thank you. And my last question, I'm just curious what kind of impact you're seeing with your staff in terms of them being diagnosed with COVID.
Yeah, we have, unfortunately, our staff also are in the community and have been diagnosed with COVID. And so the numbers I saw earlier today is that it's approximately 5% of our employees. So that of our 3,800 employees or so, that would be the number.
And are you seeing it increase along with this surge, or is that?
We are. Yeah, we absolutely are seeing an increase in COVID positive employees, community acquired.
All right, thank you all. Appreciate it.
Thank you, Tom. Next up, we are going to Delaney Smith with the Santa Barbara Independent. Delaney, can you unmute?
Oh, my bad. Can you hear me now?
Yes, thank you.
Thank you. My first question, it's to Dr. Del Reynoso. It's a little bit similar to Tom's question. I was wondering how many medical professionals countywide currently have COVID. I know that the dashboard shows in total, but I was wondering how many currently are infected.
I don't have that information for you, Delaney. So are you asking how many this week? How many active?
Yes, how many active cases?
I don't have that information, but more than happy to send that to you after.
Okay, that would be great. And then this one is for Mr. Wirft. Given existing staffing levels, I know that we are at 0% ICU capacity, but what does that really mean? How many beds do we really have? Can you put an actual number on that?
I can, yes. And so the only complexity here is staff beds versus licensed beds versus surge beds. And we had a long conversation with the county and the other two hospitals on this very point earlier today. So we have, and also we need to differentiate between the COVID isolation ICU beds and the non-COVID beds. So I'm sorry to give a long answer to this, but if you look at the licensed intensive care beds at Santa Barbara Cottage Hospital. We have a 20-bed surgical ICU that we've now converted to a COVID isolation unit. We have a 17-bed ICU, also COVID. And so that's 37 beds. But what the state is looking at is ICU capacity overall. So we have an additional medical ICU that has 20 beds in it. So every night when we prepare for possible transfer calls, we get an update from our nurse staffing office, and we know exactly how many staffed beds, meaning, doesn't mean a nurse is here right now waiting for a patient, but we know we could staff the bed if a patient came in, just as we do with patients who come into our emergency department. So out of those 57 ICU beds today, we know that we can staff 45 of them. And I think we had 37 or 38 patients in those beds. So we've never gone to zero on this. We generally have 5 to 8 ICU over the last 2 weeks. I'm referring to. We generally have 5 to 8 beds available. Just looking at our staffed beds. So I hope I'm making that clear.
Yeah.
57 licensed beds, 45 we could staff tonight, and about 38 patients right now in those beds. So we have good capacity right now. Again, I want to make the point, this can change very, very quickly.
Okay. And then I just had one more question for you. I was just wondering about staff burnout, if Cottage is doing anything around that. How big of an issue is that?
Yeah, we talked about that at our, we have an incident command meeting now since March that meets every morning. And we talked about that very thing today. And I'm really making reference to this 11-month experience. Our staff are totally committed, but burnout is absolutely a factor. Fatigue is a factor for our intensivists, for our nurse staff. And I'm going to say not just for those who are working in the COVID unit, but this has required an incredible amount of flexibility throughout our hospitals that goes to environmental service workers in and out of the COVID unit, people who are now screening at the front door who've never done that work before. And so burnout is absolutely a factor. And I don't have a specific answer to your question as to measures we've taken, but we are absolutely talking about that very thing. We've got to support our staff. This is going to continue to be very challenging for us.
Okay. Thank you so much.
Thank you.
Thank you, Delaney. Next up, we're going to Brooke Holland with NewsHawk.
Hi, thank you. Dr. DeRenoso, what's the plan for staffing the vaccination pod sites as those expand? Who will be staffing those pod sites, and about how many personnel are needed in the county?
So roughly, we are anticipating about 100 staff per pod. And as we expand the number of appointments, those numbers will need to go up incrementally. We have core backbone staff in our MedOps unit. And I want to pause, like Ron, who gave props to his staff. I just want to take a second and really appreciate my team, the medical ops team that not only are managing outbreaks in skilled nursing facilities and other congregate living situations, but they're also standing up these pods. So talk about being in the trenches for 11 months. I just want to really give them a strong and the loudest applause possible. So that is the core team. We have added additional staff to support the core team. In addition to that, we live in a county that has amazing network of volunteers, of community partners. Our first group of people that we vaccinated in our pods were emergency medical services personnel, your EMTs and your paramedics, your firefighters. Those will become our partners in the pods. We have nurses, retired physicians that have come out of retirement to assist us as well. So I am hopeful that as we continue to expand our pods to vaccinate as many people as we can, that more people will join us. So we are looking for all sorts of skills, clerical, administrative. If you have time on your hands and you would like to volunteer, please connect with us.
Okay, great. Thank you. And what would happen if there isn't enough volunteers? What's the county's plan if they can't reach the goal?
We have enough staff right now to expand to doing 2,100 next week and to 5,000 at the end of this week. We have plans in place for that. And in addition, Brooke, I'm not sure if you recall the other day, we have additionally about 42 approved vaccine providers in our county, and more providers are coming on board. So it will be the public health department in our mass vaccination centers, as well as our healthcare providers who will be partnering up with us to administer the vaccines.
Okay, great. Thank you. And what is the progress with vaccinating skilled nursing places?
So, right, skilled nursing facilities are being vaccinated by two retail pharmacies, and they are on board. What we are worried about now is that continual vaccination coverage in all of the skilled nursing facilities. Our hospitals have also stepped up in partnering with us and the retail pharmacies to make that coverage possible as well.
Okay, thank you. And what should people do after they get vaccinated?
When we vaccinate, we give out three handouts. One of it is all about the vaccine, and the second one is from CDC, and it talks about your typical reaction, like any vaccine. And it encourages the taker to ensure that they drink a lot of fluids. They're mindful of any reaction they have, and so some of those common reaction might be a fever, a low-grade fever, a headache, or some body aches. And so it goes through all of your typical, about 5 or 6 typical reactions and what to watch for. And then there is also a QR code to sign up to be monitored by CDC as well.
Okay, great. Thank you. And one last question. Looking back at 2020, what do you think the county has done well? What sort of lessons were learned? And what sort of things do you think were kind of out of the hand of public health officials that happened in terms of the pandemic?
Wow, that's a great question. I don't know if we have half an hour for me to go through my reflections. Um, what I think we did well as a county is to build upon the community partnerships. So from the get-go, we have depended on one another. Um, I, I'm looking at Ron. So Ron and Sue Anderson and Steve Popkin, the three hospital CEOs and the county leadership, met on a weekly basis to look at how do we support one another in testing. So we went from testing to now vaccination. So that type of community partnership was strengthened even more through this crisis response. So I think that's what we did well. We call upon one another, and we depended upon one another to be able to effectively serve our community. I think the second thing that we did well, unlike a lot of counties, we really, through the CEO's office, through the leadership of Terry, we really focused on communication strategies, making sure that we develop a team that would give our county, our community, timely information and the best information, the best data. And we're continually growing and developing and making data available. I have heard that our community data dashboard is one of the best in the state. We are very transparent in our response efforts. So I think that was done through a private county partnership, and that again is another great thing that came out of this: the communication building upon the private and public partnership. So those are the top two things that quickly come to mind about what we did well in 2020 through the COVID response.
Great. Thank you so much for your time.
Thank you, Brooke. Next up, we're going to Laura Place with Santa Maria Times.
Hi, everyone. Thank you. My first question is about our daily hospitalization data. I know Dr. Dorenoso, you said that due to CalReady errors or delays, we won't have the daily cases, but are you able to give an update on the number of individuals hospitalized and in the ICU today?
No, I am not. We would like to delay our Friday reporting to Saturday. So on Saturday, tomorrow, we will be reporting today's numbers as well as tomorrow's numbers. And this is really as a result of the state database and glitches and fixes. And this is where I want to say that the database, the CalReady, which is the state tracking of infectious disease response cases, was not built to endure the onslaught of a pandemic, much less the incredible, significant surges that we're seeing across the state. And so this is a result of glitches. As a result, glitches occurred. And so my team will be working, they're on standby tonight and will be working around the clock in order to process the cases, including hospitalizations that will come when the state CalReady system is on board.
Okay, thank you. And as far as the pods of vaccinations for EMS personnel and like firefighters, those kinds of individuals this week, can you give a number regarding how many of those individuals have been vaccinated this week?
Yes,
Specifically
so
for
we completed around 600, a little bit more in our pods this week.
And does that include police as well? Because I know they have a lot of, face-to-face interaction with the community. I just didn't see police specifically outlined in the vaccination tiers, so I was curious.
So the police would be under our emergency response personnel. And so this week was really focused on our emergency response, our EMTs and our paramedics, our firefighters, and where we could partner up with local communities when there was vaccine. At the end of the day, we did offer it to local police force.
And then if it's okay, I wanted to check the numbers you had listed as far as upcoming and requested vaccine doses. So did you say that right now the number is still at, as far as total received, is around the 16,770 number, but in the coming days you hope to receive 4,000 doses and then maybe 7,000 more? Is that right?
Yes, so we ordered on Tuesday 4,900 doses, and we anticipate to order next week 7,200 doses.
And are those both from Moderna or Pfizer, or which companies?
They will be from Moderna.
Okay. And then lastly, one more vaccine question. I know that Public Health has mentioned listing on their vaccination kind of website page on the public health site, giving kind of a breakdown of how many vaccinations have been received and administered and so forth. Is that data we're going to be able to see soon to just have an idea of where we're at with receiving and administering vaccinations?
Yes, we anticipate including more data on our vaccine website.
But like next week or something, or do you have a timeline at this point?
I don't have a timeline at the moment, but we are working on that and including other pieces of information like providers and tiers and especially any additional guidances that come from the state. So all of that is in our planning process.
Okay, thanks so much.
Thank you, Laura. Next up, and this will be our last set of questions, are coming from Fabiola Navarrete with Two Tiempo Digital.
Yes, hello everyone.
Hello.
Hello. This is for Dr. Van der Reynoso first. You just update us about this highest peak, no? The highest that we've ever seen. But I heard that this that we are seeing right now is coming from December 27, I think, through January 2nd. I'm not sure, but I just want you to tell us if we are. Of course, I'm pretty sure that we are expecting, but I want you to tell us if we're expecting more increases from all these gatherings and all these festivities, all these trips from Christmas holidays.
Yes, we are, unfortunately, we are anticipating the increases to continue all the way to the end of January.
Okay, thank you. Okay, about the vaccination, this is for you or also for Dr. Ron Worth. We just heard that some staff members are still afraid or they are like, showing some resistance of being vaccinated because of the side effects. Have you seen or heard something like this?
Yes, I can speak from my own team and what I know from our community partners. Because of hesitancy, a lot of staff want to wait until their colleagues have completed their 2 rounds of vaccinations before they take it themselves. So there is hesitancy, just like what we are seeing in other counties and across the country.
Okay.
But what I'm
Okay.
encouraged by is that I had also been hearing from our partners that they are seeing more staff now that they have witnessed a second dose occurred without a lot of worries being answered. They are seeing that it went fine among their friends, among their colleagues, and they are more ready to accept the vaccine. So that's very, very encouraging.
Oh, that's great. Is there something that you can tell us about side effects that of course we know are still concerning our community? Some advice from you?
I think, like with any vaccine, people there's a range of reactions, right? Depending upon your body, your chemistry, your history. Some people may feel some headaches, maybe have a little fever, may have body aches, fatigue. Some may feel chills, and some may have stomach distress. Those are some of the common side effects. We also know that it is possible for people to have a more severe reaction, and that is why part of the requirement in any for any of our vaccinators is that there be a 15-minute waiting time, an observation time, so that we can keep eyes on the community member who just got the vaccine. And there is physician, there are paramedics, there are EMTs, there are personnel on standby to assist should there be a need for assistance.
Okay, thank you so much. Now this question is for Dr. Shepherd. Well, first, I just want to say that it's great to hear all the effort you have been doing and to let you know that we keep praying for all your staff. And this is the question. How many patients?
I'm sorry. Oh, you're still with us. I was going to say Dr. Shepard had to
Sorry.
run back to the emergency room. Go ahead, Dr. Shepard.
Okay. Okay. This is
Okay.
for Dr. Shepard. How many patients does a nurse take care of? Do you know how many patients does a nurse take care of?
I think it really depends on the day. The situation can be pretty dynamic. In the emergency department, it ebbs and flows. I certainly haven't seen any unsafe ratios. I think we have a very team-based model in the emergency department. So I mean, it can depend on what region of the state you're in. But here in Santa Barbara, I've seen that nothing that I've seen has been unsafe or unreasonable. Our care models have been preserved at this point.
Okay, thank you. And my last question, do you still have enough ventilators or are you already planning to get more?
Well, as Mr. Wirth pointed out, we have quite a few ventilators at this time, and it hasn't been an issue in the emergency department. We've also really doubled down on the science of COVID, and we're using other modalities to really support patients and prevent intubation if possible. So that strategy is actually really, I think, part of the reason why mortality rate that Mr. Wirth pointed out is so low is because patients really seem to do better if you can support them and not reflexively intubate as was sort of the issue early on.
Okay, thank you so much. That's all. Thank you.
Thank you so much, everyone. That concludes today's press conference. You can tune in to the Board of Supervisors meeting next Tuesday, January 12th, for a very thorough update with public health officials. The Board of Supervisors meeting begins at 9 a.m. on Tuesday, and you can watch that live on Cox Cable Channel 20 or on the county YouTube channel CSB TV 20 or connect through the countyofsb.org website. So with that, everyone have a safe, non-gathering weekend. Practice physical distancing, wear your masks, stay home unless you absolutely have a critical errand to run, and we will look forward to seeing everyone back here or seeing you on Tuesday, and then back here for a press conference just like today, next Friday. Thank you so much. Have a good night.
Thank you.
Thanks so much.